Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I would like to talk about highly paid specialties in the service sector. So you must be surprised, what is service sector in medical specialties? So how I usually divide is the service sector is an area where you don't directly, actually patient don't directly come to you. Patient will come to some other specialist like surgeon or a physician or a gastroenterologist or oncosurgeon or somebody, and you are also working in the hospital part, and you will be taking care of patient in one part like anesthesiology or intensive care. So no patient comes to anesthesiologist, but the thing is like you are actually involved in taking care of the particular patient in one segment of his treatment. So that is defined as a service sector. So many laboratory services and everything, pathology and everything will come in the service sector. So these service sector specialties will have certain advantages and disadvantages. So in these specialties which are like highly paid, okay, that is what I am going to tell you. So before going into the presentation, so what actually, what kind of mindset a person should have when you're coming into the service sector is what I would like to briefly tell you. So there are, as you all know, there are extroverted people and introverted people, right? So if you are an introverted person, you would like to stay within confined spaces, and you want to stay away from big gatherings, and you want to stay sit in a room and read your books and all that. There are many people, many doctors like that. If you have that kind of a mindset, then service sector is the best for you. Okay, so because nobody is going to disturb you, you can do your work and all that. And work-life balance. See, there are two categories of people mainly: ambitious people and people who really want work-life balance. Okay, so if you're very ambitious, go for these specialties like surgery, physician, where you are patient facing and you are judged based on the revenues that you generate in the hospital, and you compete with people and all that. But if you're not so ambitious, you want to have a good work-life balance, and then I think you should go for service sector specialties. And in that again, which is better is what I'm going to tell you. You can come into those areas. And then and the next thing is, if you're a long-term thinker. So long-term thinkers are like, for example, right now you would be earning a little lesser, but over a period of time, like over a period of decades, if you're planning to grow in your career, planning to save money, and so if you're that kind of a thinker, say for example, stock market, when you're investing, there are two kinds of people, right? One will put some bulk money, exit. So the second type of people who invest in SIP basis in mutual funds, they wait for long terms for returns to come back. The two categories of people. The first one is more impulsive, second one is more like a long-term thinker. I would call, if you're a long-term thinker, come into service sector, because in the long term you actually grow in service sector, better than other specialties. And you are not in the power game and comparison game. Power game is like, I am more powerful, people listen to me in the hospital, people actually follow me and all that. See, that doesn't happen in service sector, because in service sector it is more like you are actually involved in a segment of care in the total treatment plan of the patient, right? So if you are not a power seeking guy, then you come into service sector. And if you are okay with colleagues crossing you financially, for example, you are a particular intensivist or something, and then your MBBS batchmate is a surgeon in the same hospital, and he is actually earning more than you, for example, I'm telling, which might happen, might not happen. You might be earning more than him. I've seen all kinds of permutations and combinations. But for example, if he's crossing ahead, then you don't blame your specialty, saying that, I come into the service sector or intensive care I'm doing, and hospital doesn't recognize my skills, and he is actually going ahead of me. So those kind of things you shouldn't be having actually. If you have the particular mindset of what I explained till now, then please welcome. I am also in service sector. You can come into service sector. Since I am a neuroanesthesiologist, so I am involved basically in the intraoperative area and taking care of patients in the intensive care. But neurosurgeon will be seeing the patient from door to door, from the admission to discharge of the patient. Okay, so that is the difference between the other specialties and service sector specialties. Multiple times I'm using the term service sector. Don't feel bad for that. Just for the ease of understanding, I'm using this word. And see, if you're passionate about something, For example, there are some people who are very passionate about, radiation oncology, very passionate about intensive care, something in their MBBS would instigate them to think and develop passion towards something. Okay, so for me actually, when I took in anesthesia, there is a story behind. There is a video also in my channel. Based on that story, I got passionate towards anesthesia. When you have passion towards some specialty, and then you should actually do it. Okay, and because people usually grow in areas where they're passionate about, and if they take the decision on their own based on some story, usually I've seen people growing. Don't see whether it's the service sector or what is the scale, ceiling is there, and all those things you should not think about. Okay, if you are passionate about something, please enter the specialty. Okay, never compete when you're in service sector. In service sector, you should always think about quality of the care, patient satisfaction, and other indicators are there. It's not about competing with other specialty people and feeling bad all the time. So then there are some advantages also for the specialties which I'm going to tell you. The main advantage is that there is no revenue pressure. So revenue pressure is like, for example, if you are a surgeon, for example, you are a physician, or you are a gynecologist, or you are some other pediatrician, there is always a revenue pressure on you. How much you are earning, everything is calculated. So that kind of pressure will never be there in service sector. You are always assessed based on the quality of your care, your communication, and all that. Okay, and what I actually saw is hospitals actually treat these service sector specialties as their own people, and they treat those other specialty guys like surgeons and medical guys and other people as generating revenue for the hospital. But usually the service sector specialties, the management is considering them as their core group of the hospital, and they usually don't bother them with the revenues and etc. Okay, if they're not maintaining the quality of service, for example, if you're not maintaining proper charting, if you're not maintaining proper records, or you're not taking care of patient's pain, or not explaining things well, so that is how you'll be assessed. Okay, not purely based on the revenues. And most of the times there is no major fluctuation in the workload. So most of the service sector specialties like anesthesia, intensive care, and whatever I'm going to tell you now will be shift based work, emergency medicine and all that. So what happens is you will have a shift, so pretty much constant work will be there. For example, mine will be morning 8 to maybe 5:36 and all that. I will have a night duty and next day off. But surgeons won't be like that. The neurosurgeons who are working with me would actually work more when the cases are more, they work less when cases are less. There will be a waxing and waning kind of pattern for the sales sector, I mean the surgeons and physicians. But for service sector, it's pretty constant workload, so it's very easy to plan your schedule ahead. You want to go somewhere for a party or something, then it is pretty easy with a service sector specialty. Okay, and then overseas opportunities. In the end of the presentation, I will tell what overseas opportunities and why these specialties which I am going to tell now are favored more than the so-called all the fancy specialties. And then the ease of shifting hospitals also. So basically when for example a big clinician wants to shift from one hospital to another hospital, he will think about multiple things, about his patient load, his local influence and his local power, and so many aspects he need to consider. But service sector is not like that. For example, as anesthesiologist, if I have to shift from one hospital to another hospital, I will just pack up my bags and go to another hospital. I don't have to think about multiple things. The ease of shifting is there. That's another advantage of being in these specialties, which I'm going to tell now. Less problem with the patients. Nowadays the demands of the patients are very high. You need to actually meet the demands. There is no other way, because the world is changing, and it is almost the kind of patients whom I deal are just equal to anybody in US, UK or any other country. So when you're dealing with such kind of people, there will be some kind of discomfort and problem, but that is you can't. That's how the expectation has grown, increased now. You have to meet the expectation, and this particular meeting expectation, usually the service sector people are not that patient facing, right? So that much won't be. There will be a little bit, but it will be more for clinicians and other specialties. It will be slightly lesser, so you're less troubled by the patients and the attendants. And more scope for education and research. So what I observed is the education and research and new articles, original articles are more actually coming from these specialties like pathology, microbiology, anesthesia, intensive care and all that, than compared to clinicians. The reason being the clinicians are more busy working for more hours than these specialties. So basically when you get some free time only you can do, right? If you're working for 12 hours in a day, how can you do some research and all that? So that is the reason more education research also is coming from these specialties, and medical legal implication also are lesser. So before going into the highly paid specialties, so basically I am talking about the highly paid specialties in service sector. So what is highly paid? So I have to define it, right, before going into the video. So how I defined is the monthly expenses I made. You can see in the screen. For example, if you are having a good upper middle class life, if you are staying in a good gated community, the rent will be around 50,000. The food bills will be, if you are cooking in home, then maybe 4 to 10,000. Internet, electricity, recharge will be between 3 to 5,000. Transportation another 10,000 for your petrol and all that. And then your children's education is pretty damn expensive, right, in metros. So you take if you have one kid or two kids, 30,000 per month. That is like 3 lakhs if you keep them in international school or something. And then insurances, you need to pay your indemnity, medical, health insurance, term insurance, and so many insurances will be there. Even parents insurance and everything you have to pay, right? So even though you get some kind of a tax reduction from at the end of the when you pay your taxes, that's a separate topic. We can discuss that later. And so your maid's payments will be 10,000. So total monthly expenses in good living would be 1.2 to 1.3 lakhs. Okay, I want you to earn more than this. Okay, and then for example, if you are earning 3 lakh rupees, and if you remove 1.2 for expenses, you will be left with 1.8 lakhs, right? So that 1.8 lakhs, if you invest, okay, the 1.8 lakhs, if you I want you to be saving money. Okay, read Psychology of Money book if you are not read. So these 1.8 lakhs, if you invest properly, then what happens is in a 25-year period of time, if you invest in any kind of return, real estate or mutual funds or stocks, whatever, if you get minimum of 12%, it would become 34 crores, 72 lakhs, 67,222 rupees. 34 crores is a very big amount in 25 years. Then if you ask me, Dheeraj, now see you're telling 34 crores in 2024 it will be very high amount, but in 2050 it will be 34 crores wouldn't have much value, right? So if you're thinking like that, the next slide is for you. I actually calculated, so what is happening, why money is losing value is because of inflation, right? Inflation, it's a simple inflation concept. So 6% is the rate of inflation which is happening now, and if you calculate, inflation calculator is a technology where you can put your amount and see how much it will depreciate in future. So the 34 crores, if you put in inflation calculator, it will become 8 crore rupees. So that means that the worth of 8 crores at present is 34 crores in future. 8 crores is not a small amount, right? If you have 8 crores now, if you put in fixed deposit with 6.5% interest coming in a year, monthly 5 lakhs plus will come to you. That is enough to retire, right? So if you earn 3 plus lakhs in a month, that is considered highly paid, or not highly paid, a very good pay according to me. Okay, so even if you retire, you will have 34 crore rupees, which is equal to, if you put in FD, 5 lakhs plus at present. So that same standard of living you'll have. 5 lakhs if you have now coming passively, you can live like a king, according to me, in any part of India. Okay, so that is the kind of money. Then if you're earning like more 5, 7, 8 lakhs, 10 lakhs and all that, I don't think it is required, because 3 to 4 lakhs is enough in a month if you're living in a decent way. Above that, whatever you're earning is for your next generations and generations and generations, and then you're not going to enjoy really. That is what I'm going to tell you now. So that 3.5 lakhs if you reach, that's a sweet spot. But when are you reaching that? You have to reach in a point of career where you at least have 20-25 years of career after that. Okay. If you reach in the end of your career, it doesn't have much value. You have to reach it little early. With the specialty which I'm going to tell now, you will be able to do that. Okay, so let us go into the specialties now. The service sector, number 1, anesthesiology. See, what is happening is with the increased sensitivity of the patients. Okay, patients want more comfort. They don't want even IV cannula. They don't want to be put in normal. Even for that, luckily we're not doing that in anesthesia, but there might reach a point where IV cannula also will put in anesthesia. Now every procedure is done under anesthesia. So when the patient's expectations increase, when the comfort levels increase, the number of anesthetic procedures will increase. That is not the only concept. When the complexity increases, when the new technology is coming up, okay, so the anesthesiologists also should keep up with that, and then they should also evolve with that. More complex kinds of anesthesias are coming up. So you can see here. So previously there is only general anesthesia, but now so many types of anesthesias are there. Cardiac anesthesia, who deals with only cardiac surgeries and interventional cases in the cath lab procedures. Neuroanesthesia, which is my specialty, which will be dealing with the brain surgery, spine surgeries, neuro monitoring, neuro ICU and all that. Pediatric anesthesia, though I can actually do a separate video on that, because this is where many people are a little weaker. If you do pediatric anesthesia and start your practice, you will be more comfortable in practicing. That is where many people are actually lacking. And even if you go to Middle East, they allow to practice any case, but pediatric though they don't allow. Okay, because if something goes wrong, it's a big problem, right? So what they do is they need sign off or certification that you have done a proper training in pediatric anesthesia. Okay, pain medicine is another specialty which is coming up, but the problem for pain is that these orthopedicians and other surgeons, they don't usually refer patients to you. If you have a good social media presence and if you're developing a good pain practice, then it's nothing like that. Trauma anesthesia is coming. I've done a video with Dr. Kajal, who's Chief of Trauma Anesthesia and PGI Chandigarh. You can check out that video. There is a lot of scope in trauma anesthesia in future. Transplant anesthesia also I've done a video. Basically liver transplant is where you need expertise. So if somebody is doing fellowship in transplant anesthesia, they will flourish, because a lot of transplant centers are going to come up in future, because everybody is going for organ donation now. If you want to take a license, you have to take you don't have to tick, but there is a box that you want to donate your organs or not, they're asking. So transplant centers will increase in future, and people's awareness also is increasing, right? After we die, what will you do with our organs? So this mindset people will develop and they'll start donating. So if I donate my organs, for example, while taking driving license or something, then once something happens to me, the organs will directly go to the thing, but some permissions will be there still, but that process will be activated even if somebody is refusing to give. Okay, and obstetric anesthesia is also a very good field. A lot of mother and child centers and all these centers are coming up, right? So there the demand for obstetric anesthesia is there. Regional anesthesia is if you are planning to do freelancing, regional anesthesia is must, because most of the procedures you have to finish in regional anesthesia. Freelancers, I have done a video, right? They easily make this 3.5 lakh, very easily make. Even if you do one and a half case in a day, at the end of the month you'll make this money. But regional anesthesia is must for freelancing. And Ganga Hospital is good, you can go there and do it. Onco anesthesia is very good. If you're doing, you have to do it in onco anesthesia. If you're planning to do, then Tata is a very good center. I've done a video on onco anesthesia. You can go there and actually do the onco anesthesia fellowship. And after that, onco anesthesia, if you do, the advantage is that even if you're practicing normal anesthesia, there are a lot of high risk cases you would have dealt during fellowship. It will help you in practicing even normal anesthesia. Onco patients are very frail, right? You'll get used to managing such kind of high risk cases. So whatever types of anesthesias I explained, if you get 5 to 7 years experience in these things, easily you can come to the amount of money which I quoted, very easily. So, and then you can have this good quality life in future. Okay, so anesthesia is the specialty to actually reach this point. Next, intensive care. So intensive care is a specialty where you take care of patients in ICU who are in very critical stages. So previously in the ancient time, what happened is the intensive care is being nobody is actually interested. It is considered like we don't want to go there. So they gave up the intensive care specialty to anesthetists, and they actually developed the skills towards that, putting lines and monitoring the patient cardiac output and all that, learning ultrasound. And now, since there is a lot of business developed around that, everybody wants to come in. Even emergency physicians want to come in, general medicine people want to come in, some surgeons also trying to come in, and so many people are trying to come into. Maybe even the eligibilities are only for anesthesia, emergency medicine and pulmonology to enter the general medicine also has eligibility to enter intensive care. DM intensive care. If you do DM intensive care, easily you can reach this target of what I told. Very easily you will reach. And but what I recommend is if you do general intensive care, 10-15 years down the line you might have a problem, because what happens is general ICU concept is going off and subspecialty ICU concept is coming up in all the hospitals. Like my ICU, my hospital, neuro ICU will be separate, pediatric will be separate, medical will be separate, transplant will be separate, so and post, like so many ICUs will be there. You better place yourself in one area and brand yourself that you're an expert. You can't tell I know everything in the world. You have to tell that I am expert in this particular area, like I'm a neuro intensivist, I'm a cardiac intensivist, like that you have to brand yourself. Only then in future it will work out. If you tell that I'm expert in everything, I can manage everything, then it is more like telling I don't know everything. So it is better to brand yourself and tell that I know this area, I'm an expert in this, publish in that area, give talks in that area, and tell the world that you are an expert in that area. Okay, these are different kinds of ICUs where you can subspecialize: medical ICU, surgical intensive care, cardiac intensive care, neuro intensive care, pediatric intensive care, NICU, burns ICU, trauma ICU, transplant ICU, HDU. But everything is not a subspecialty. But in that you can like medical intensive care anyway you're managing already. Neuro ICU and neuro ICU you can try, and trauma ICU you can try. And then transplant ICU, cardiac ICU, separately you can actually manage. At present, neuro anesthetists are managing neuro ICU, cardiac anesthetists are managing cardiac ICU. But in future, if somebody is coming with a degree in neuro ICU and cardiac ICU, they will manage those areas. When an exclusive person is there, usually hospital will appoint them and keep them in charge of that, so that that area will develop and become high quality in future. Got it, no? So that is how you need to plan your intensive care. So with the ICU, easily you can reach the point of 3.5 lakhs. So nuclear medicine and radiation oncology, I would like to talk. Even with these two specialties, you can reach the point which I told, with 6 to 7 years of experience. Nuclear medicine is what you're seeing in the image. So I will show you here. So this is the device through which the patient will go. These are called gamma cameras. So radioisotopes will be injected into body, right? So when they pass through the body, the gamma cameras will catch the image and then a scan will come out. So PET scans, SPECT scans, and all the scans will be done. Even cardiac perfusion testing also can be done. So all this will increase in future, because as I already explained, the incidence of cancer and all those things are increasing at 12.5 to 13% per year. Millions of patients will have cancer, and more people are required in this area. It's not about earning money, it's like requirement, basic requirement of radiation oncologists and nuclear medicine specialists are very few in country, right? So I think the number should increase. So about radiation oncology, my brother is a radiation oncologist. We have done a video. I usually interact with him. What he usually says is the problem is, so one person is enough in a center is what he says. So if, for example, if you produce of 10-15 people, like they can actually cover 10-15 centers. With those many centers will be there in one state, right? So that is what is the problem with radiation oncology. Maybe we can't increase the number of seats in radiation oncology, but if you're a radiation oncologist, you can easily touch this salary. Okay, so if you do radiation oncology, get a job in, for example, proton therapy is the trending thing now. Which is like each patient, they charge around 25 lakhs to 50 lakhs per therapy. Multiple sessions will be there. If, for example, you're a radiation oncologist and you branded yourself as an expert in proton beam therapy, then anywhere between 5 to 10 lakhs can be your salary, because so much money is being generated there, right? You have to, if you're giving that result, expert means you have to give that result. You have to be working hard, precise result you have to give every time. For that you need international exposure, international degrees, research in that area, and dedication, commitment, and you have to give that result. Only then you will reach these higher packages. But there is a scope. The problem also I told you can get saturated, because one person can manage, it seems. That is what people feel. Okay, but according to me, it's a very good specialty. So these are the new technologies which are coming in radiation therapy. So biology guided radiation therapy, intensity modulated radiation therapy, and stereotactic radiation therapy, MRI guided linear accelerators. Proton therapy, which I explained, is the costliest procedure. The advantage is the protons can precisely damage the tumor cells without damaging the surrounding structures, and I have seen many cases from neuro going for proton therapy. Previously it was there only in Japan, but now it is available in Chennai. In Apollo has this proton therapy, and AI also is big time coming up in radiation oncology, so the treatment will become more and more precise in future. So I think this is the time to enter radiation oncology. and I forced my brother to enter into radiation oncology. And interventional radiology is another service sector where they put catheters and do angiographies, IVC filters, stents, and then TACE, and if ERCP fails, they have a procedure for that, and foreign body removals and biopsies. Even a lot of our spine patients, they do biopsies under CT, and even cancer therapies. They, if for example retinoblastoma is there, they send catheters and send direct to deliver the drug into that particular area. So many types of inventions are coming in interventional radiology. So you can actually think about this, because very few people are there in India at present, and if you want to settle in metros and reach the amount of money which I told, much more than that you can make, but minimum that much you can make. So it's a very good specialty. So you can bet on this if you have trust in me. Physical medicine and rehabilitation is another specialty where a lot of hype is going on, and as I told in my previous video, in future what happens is lot of people will actually require physical medicine rehabilitation. But the thing is, now MD only rehab is not enough. You have to subspecialize in that. Like for example, pediatric rehab, spinal cord rehab, cardiac rehab, respiratory rehab, transplant rehab. Somewhere you have to brand yourself that you are an expert in that, because if more people are coming, if you again branding is a concept where you have to tell people that one area I am an expert. Okay, so you need to subspecialize again in rehabilitation. Surely you can reach this point. Robotic rehab, if you claim that you are an expert in robotic rehab, you have a very good future, because a lot of robotic rehabilitation centers will come up in future. Okay, the setup is a little expensive. It will take 8 to 10 crores, but the lot of foreign investment is coming into healthcare in India, so that wouldn't be a major problem in future. Emergency medicine is a specialty where you treat the patients in emergency, you stabilize them and shift to particular concerned specialists. So they work in shifts, even though they have an intense schedule. If they work in shifts, and in that shift it will be intense, but thing is you need a lot of people in a hospital. Like anesthesiologists, like any hospital will have 20 to 30 anesthesiologists, right? There are some hospitals in India 50 plus anesthesiologists are like. In the same way, emergency medicine also 10 to 15 people will be there in bigger hospitals, and in a smaller hospital around 5 to 8 people will be there. So you will have a shift based work and more exciting life, and usually what I observed is, if you are in charge to that particular place, easily you can make this money, more than this you can make, and surely you can reach this point. And every hospital will have emergency medicine wings, and a lot of requirement will be there. The radiation oncology, the problem is that one person can manage a center, right? That can't be done in emergency medicine. You need more people. So if you are interested in little adrenaline junkie, and if you want to do, you can take this and easily you can reach the point which I told. Okay, transfusion medicine is another area. So blood bank is becoming core of a hospital. For example, like neuroanesthesia, I will always be in touch with the blood bank people about how many bloods I require, what type of components. Now it's not like blood, it's component therapy which is going on, PRBCs or platelets. I'll ask specifically what do you want, cryoprecipitates. So, and plasmapheresis also they're doing for myasthenics or any autoimmune disorders. Okay, like myasthenia gravis or any Guillain-Barré syndrome in neuro, plasmapheresis will be done by transfusion medicine specialist only. So both therapeutic as well as maintaining blood bank. So they will have a significant role in future. And the same problem, radiation oncology, one person would be enough. So many people can't be produced, but that few people can easily reach this kind of a salary with a good experience. It's not a big problem. Okay. But you should be more into the quality. Now you should be obsessed with the kind of details and all that. If you're that kind of person, you can take. So these are the specialties which can reach this particular amount which I told. And about the opportunity, the service sector, the specialties which I told are very easy to go to other countries than the surgeons, physicians, and all those specialties. The reason is, so basically, for example, if you are going to UK or USA, most of the times the surgeons and other areas, they'll take local guys like USA guy. But behind the screen work, where a service sector does, that they will be okay for anybody. So that is one of the reasons. So the patients actually, when they go to a hospital, for example, if they go to Dubai hospital, they want a person, American or a British guy to treat them. But behind the screen, what is happening, nobody will know, right? So that area usually they fill off with all these specialties from countries like India, Pakistan, Sri Lanka and all that. So you will have higher opportunity to go to Middle Eastern country and earn like 5 times the salary of what your friends are earning in India with these specialties. So my channel, so a lot of videos are there in Middle East, Dubai, Abu Dhabi, Saudi and all that, Australia. You can go through all those videos. Okay, service sector specialties nobody talks, so everybody wants to become big time cardiac surgeon or a vascular surgeon or this surgeon, or they want to become everybody wants such a patient facing specialty. But problem is that it comes with a price of revenue pressure and constant competition. You have to think, okay, if somebody is picking up, you are coming down indirectly. So all the problems won't be there in service sector, and you can mind your business and coolly live your life in a shift based work, go to other countries, you will have flexibility and all the advantages I spoke in the beginning. So I recommend, if you take a service sector, I'm in a service sector, I'm very happy, and I never regret taking up anesthesiology and neuroanesthesiology that too. So this is a very good field. You can actually take up any service sector specialty, and but only thing is, don't compare yourself with some other doctor who's progressing in the non-service sector patient-facing specialties, because like patient-facing specialty, there is no ceiling. They can go to any amount of salaries, but service sector there is a ceiling. The issue is that, but you don't require, I'm telling you, you don't require amount more than 6-7 lakhs or 10 lakhs. Maximum 3 to 5 lakhs is enough. Even if you have 3 to 5 lakhs, you will end up giving to children only. You will not spend more than that. Okay, so thank you guys, thank you very much for following the video. Hope this video helps you in taking decisions, and it will help many thousands of doctors who are watching my videos. And the last video, you guys liked it, and a lot of people are sending comments. It is good, and we'll do Q&A session also. Many comments I'm liking them, and it is changing my perspective also. So these videos are a forum where we can discuss, and we can come up with conclusions in future. So this is my perspective, right? Many doctors are putting their perspectives. We are very much welcome. Negative feedback also you can give. We think that there is a platform to discuss all our opinions of future. Okay, so that is what I'm trying to create. And thank you very much for following the video till now. Thank you all.